Normal weight-bearing foot X-ray. Normal weight-bearing foot X-ray. The weight-bearing foot is the most functional position for X-rays of the feet and ankles. Normal weight-bearing foot X-ray. Non-weight-bearing X-rays may show a reduced deformity of the foot and ankle or less apparent disorder. But the weight-bearing X-rays provide the most accurate assessment of functional bony anatomy of the foot and ankle. This study aimed to evaluate how these measurements change when the patient is weight-bearing. A non-weight-bearing X-ray may miss a number of common abnormalities in the foot and ankle, including deformity of the toes, bunions, and hammertoes. In order to get an accurate assessment of foot function, a full weight-bearing AP and lateral views are required. These views have been shown to approximate the position of the foot during dynamic gait. The two most common types of weight-bearing X-rays are the tangential weight-bearing postero-anterior view and the weight-bearing lateral view. The latter is more common, and gives the most accurate assessment of the foot's function. The tangential weight-bearing postero-anterior image of the hindfoot is another type of X-ray. A normal weight-bearing foot X-ray, called a Saltzman view, is a key diagnostic tool for assessing the bones and soft tissue in the foot. This image allows the physician to determine the percentage of body weight the foot bears. The talus is also visible in this view. The Saltzman view is used to evaluate the calcaneus and the talus in a patient's ankle. A weight-bearing foot X-ray should be performed with full weight-bearing views. Normal weight-bearing foot X-ray. The non-weight-bearing view may mask significant abnormalities and make measurements invalid. A full weight-bearing lateral and AP view should be performed to evaluate the foot in a functional position. While the lateral and AP views are commonly used, they are not as accurate as the weight-bearing image. The weight-bearing foot X-ray is the most accurate way to diagnose an abnormality in the foot. In a non-weight-bearing position, the X-ray will not show significant abnormalities. Moreover, a non-weight-bearing view does not give a clear picture of the anatomy of the foot. It will not provide accurate information. However, a full weight-bearing lateral view is more accurate. The weight-bearing lateral view is the most accurate. It allows doctors to assess the structure of the foot's tendons and ligaments. It can also help them to diagnose injuries and evaluate treatment. The X-rays can also show abnormalities of the ankle and feet. These types of X-rays should be performed when the patient is not weight-bearing. The lateral view helps to detect ankle problems. A non-weight-bearing foot X-ray is not always useful for diagnosing deformities of the foot or ankle. Normal weight-bearing foot X-ray. Non-weight-bearing X-rays cannot show problems with the ankle and foot, and a normal weight-bearing foot X-ray does not provide the necessary information. It is often difficult to diagnose a deformity in the foot, so the weight-bearing lateral view is the most accurate way to evaluate a problem. X-rays of the feet and ankle are essential to diagnosis deformities of the foot. A non-weight-bearing lateral X-ray does not show deformity. It does not show the relationship of the hindfoot to the leg. Further, non-weight-bearing lateral images cannot demonstrate structural changes in the foot and ankle. Therefore, a weight-bearing lateral image is essential for identifying structural changes in the foot or ankle. A weight-bearing lateral foot X-ray is very important for the diagnosis of foot deformities. Non-weight-bearing views do not show the bones in their functional positions. A weight-bearing lateral foot radiograph is vital for the proper diagnosis of these deformities. It is very important to encourage normal weight distribution. There are no radiographic findings of abnormalities in non-weight-bearing feet. Although a non-weight-bearing lateral weight-bearing foot X-ray is not necessary for the diagnosis of hallux valgus, nevertheless, it is very important for surgeons to consider the patient's weight-bearing tibia to determine whether he or she should perform surgery. Further, the tibia must be vertical in order to identify the correct alignment of the foot. Normal weight-bearing foot X-ray. Normal foot X-ray, normal foot X-ray, normal foot X-ray.